before using an AED, but if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
First.
Provide.
Okay. So, I need to be careful going up, don't want to fall, right? Okay guys, so the AED, okay? The AED again is automated external defibrillator, okay? So now, how it looks like is like this. Okay, it's AED, okay? There's a lot of brands, there's different brands of AED, but the general AED looks like this, okay? The one that we're going to use for practice, okay, it's a smaller version, okay, but again, we won't see an AED like this, but for practice, this is what we're going to use, okay? Now guys, for an AED, okay, an automated external defibrillator, okay? So, most schools, most facilities, even like groceries that we went to, okay, they have AEDs. Okay, I'm not sure if if our worship center has an AED, but most of the time, okay, every organization or every staff member has one. Okay, now the AED guys, okay, the common question is mono. Now that we found an AED, for example, okay, and then we ran, okay, the person, okay, who's being resuscitated or being given compression, okay. When do we apply the AED? Okay, how do we use it? Okay? So now guys, regardless of the brand of the AED, okay, take note of this, okay? Take note, okay? What is the first thing you need to do if you have an AED? Let's say while you're doing compression, okay, while you are assisting a victim, you receive an AED, right? What's next? Right? What's the next thing you need to do? Okay, take note, switch it on first. Okay, it's very simple, okay, but take note of that. Okay, once you receive an AED, what do you need to do? Turn it on first. Okay, turn it on. And then the second one, okay, what do you need to do? Okay, follow the prompts. It's very simple, right? But that one usually, guys, in an emergency situation, most of the time it's chaotic. Okay, it's chaotic and a lot of people, don't know what to do, okay? But always return to the basic. Always keep that in mind. Okay, so once you have an AED, switch it on, or turn it on, and then follow the prompts. And then follow the prompts, it will tell you what to do. Okay? So now, let me turn it off first. Now the pads, okay, the pads look like this. Okay? Most of the pads, okay, will look like this. Okay? It will look like this, okay? So on your end, guys, okay, because a lot of people they get intimidated once they can see an AED, right? But again, guys, okay, you just have to turn it on, follow the prompts, and then just follow the pictures. In the picture, it will tell you, okay, this one, apply it here, okay, and another one, apply it here on the other side. Yeah, of course, that tool should be, that tool should not be, will not be present, okay, it has to be in the skin, okay. So now, guys, this is the most common AED pads, okay. There are other AED pads that look like this. Like a one set of AED pads. Okay? So for this one, okay, if you encounter something like this, same thing guys, just follow the picture. It says here in the picture, you have to apply it like this. Okay? And then you connect. Okay? So for example, this one, okay, switch it on, pads, okay, so you follow the picture. So this one, okay, goes here.
Apply pads to patient.
And then this one says here, apply here. And then plug it here. Okay?
Do not touch the patient.
It will tell you don't touch the patient.
Heart rhythm.
It's going to analyze. Okay?
Do not touch the patient.
Hear it?
Analyzing heart rhythm.
Okay? Then,
Shock advised.
shock is advised. Okay, it's going to charge.
Stay clear of patient.
Okay?
Deliver shock now.
Now, very important, okay? If you are the one who's going to press the shock button, it's very important, okay? That what you see in the movies, okay, you have to say everyone clear. Okay? Once you say everyone clear, and then you press the shock button.
Apply pads.
Okay? Let me turn it off first. Okay? So now, going back guys, okay? Why is that shouting, okay? Everyone clear important. Okay? If for example, okay, and this is electricity, okay? So the AED tries to eliminate abnormal heart rhythm. So it gives shock. If someone is still touching the victim, okay, and then you press the shock button, what happens is that person who is also a responder could also receive the shock. What will happen? You will have two victims now. Okay? So that's why it's very important, okay? If you're the one pressing the AED, the shock button, you have to shout. You see this also in the movies. Everyone clear. Right? Everyone clear. Okay, you have to make sure no one is touching the victim. Okay? Once everyone is clear, and then you press the shock button. Okay? After you press the shock button, the AED will tell you, as I mentioned, it will tell you what to do. It will tell you, begin with compressions, and then you start the compressions again. And also the AED will produce a sound, okay? A sound like a bell, okay? A ticking sound. So that one you can follow when you're doing the compression. Okay? And if you remember, guys, I mentioned 5 cycles, approximately 2 minutes, right? That 2 minutes is very important. Why? Because every 2 minutes, okay, we reassess the victim. Every 2 minutes, that's the time we switch roles. And every 2 minutes, regardless of the brand of the AED, every 2 minutes is the standard, the universal time for every AED to reevaluate the patient. What we want you to see is how to properly use the AED, okay, which you guys did, okay? You follow the prompts, you apply the AED pads, and then you have to wait for, okay, when the AED tells you, don't touch the victim, take a touch the patient, analyze it. When it's analyzing, don't touch the victim, okay? Now, the AED, as I said, you have to follow why. The AED can tell you whether shock is advised or not advised, okay? But it will tell you shock advised, charging, okay? Once it's charging, it will tell you give shock now, okay? Again, whoever's going to be operating the AED, okay, needs to shock everyone clear. Okay, you have to make sure no one is touching the victim before you press the shock button. Okay, because we don't want to have another victim. Okay, so now later on, okay, we're gonna practice doing, okay, we're gonna combine, okay, as a team, we're gonna do team dynamics. This group that you have right now, okay, one will operate the AED, another one will do the compression, and another one will give breaths. Okay, so right now, at least we know that you guys know how to apply the AED. We're going to practice this later. Okay, so now, what if, okay, the question is, what if, for example, the AED is analyzing, okay, and it says no shock advice. Okay, good question. Okay, so now, as I mentioned, cardiac arrest guys, okay, in cardiac arrest, okay, what happens is it's either the heart stops pumping, okay, or beating, or it's just quivering. Okay, so now if it is quivering only, okay, once the AED felt that quivering, okay, that's a shockable rhythm. It's a shockable, so the AED will try to shock that to restart the heart. And usually, if it is like flat, let's say that the heart is not moving at all, it's like a systole. We call it a systole, like not no pulse at all. That one, the AED will say, do compressions, start compressions. Okay, but if, for example, okay, there's not enough, there's the slight pulse, but the heart is just quivering like that. That is the shockable heart rhythm. And then the AED will try to restart the heart. Okay, so that's why you have to shout everyone here, because if someone is touching the patient, once you click, shock, it will give a shock to the victim's heart and the responder's heart if someone is touching the victim. That's why the responder could go into arrest as well or become unresponsive as well.
హలో అండి అందరికీ నమస్కారాలు. నా పేరు సుమంత్ రామ్శెట్టి, ప్రెసిడెంట్ TLCA 2026. ఈరోజు న్యూయార్క్ తానా కార్యవర్గం జరుపుతున్న CPR ప్రోగ్రామ్కి ఇక్కడ హిక్స్విల్ అసమాయి టెంపుల్లో అటెండ్ అవడానికి పాల్పంచుకోవడానికి వచ్చాను. తోటి కమ్యూనిటీ మెంబర్గా చాలామంది వచ్చారు. CPR అనేది ఒక ఈవెంట్ కాదండి, అది అందరికీ ముఖ్యంగా కావాల్సిన ఒక లైఫ్ అండ్ డెత్కి మధ్యలో ఉన్న స్కిల్. ప్రతి ఒక్కరికి అవగాహన ఉండాలి. ఇంతకుముందు కూడా 2019లో నేను తానా RVPగా ఉన్నప్పుడు ఈ కార్యక్రమం చేయడం జరిగింది. ఈరోజు చాలా చలి ఉంది, వెదర్ అలర్ట్ ఉంది. స్టిల్ అయినా కానీ శ్రీనివాస్ పర్తవరపు RVP గారు, అలాగే ప్రసాద్ కోయి గారు, అలాగే అందరు కార్యవర్గం, ఎంటైర్ న్యూయార్క్ తానా టీం ఎన్నో చక్కటి కార్యక్రమాలు న్యూయార్క్ అందిస్తూ కమ్యూనిటీలో మమేకమవుతూ పిల్లల్ని ముఖ్యంగా వారందరూ కూడా నేర్పిస్తూ ఉన్నారు. ఇలాంటి కార్యక్రమాలు మరెన్నో చేయాలని, అలాగే మా సంస్థ తరపున TLC తరపున వారికి ఎప్పుడు మేము అందుబాటులో ఉంటామని నాకు ఈ అవకాశం ఇచ్చిన TV5 అండ్ మన టీవీ ప్రేక్షకులకు నమస్కారాలు. థ్యాంక్ యూ.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive inhalation.
The team member operating the AED or the monitor defibrillator can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes training decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occurred, including frequency and duration of interruptions and chest compressions, time of shock delivery, and medical
will tell you don't touch the patient, analyze it. Because every 2 minutes it analyzes the patient. Now, while the AED is analyzing, it will tell you if shock is advised or shock is not advised. Okay? Sometimes it will tell you shock not advised. Continue with compressions. Okay? So again, that's why it's very important. Once you have the AED in place, you have to follow the AED. Who is unresponsive or having cardiac arrest, it's the same thing with adult. When it comes to, for example, okay, scene safety first. Okay, if for example you saw an unresponsive child, okay, what should you do? Okay, if you saw an unresponsive child, okay, the first thing again, same thing with adult, scene safety first. Okay, you have to determine the scene is safe. Okay, and then approach the victim. Okay, once you determine the scene is safe, and then same thing, you check for responsiveness. Okay, when you check for responsiveness for a child, okay, it's the same thing. You tap the shoulder. Hey, are you okay? Okay? And then same thing after checking for responsiveness. If the victim is unresponsive, okay, call 911, get the AED, okay? And then you assess, okay? When you assess, same thing, carotid pulse, okay? Carotid pulse, and then also the, okay, checking the rise and fall of the chest. Adult and child, when you check for responsiveness, you tap the shoulder. Hey, are you okay, right? Like this. Hey, are you okay? Right? For an infant, you don't tap the shoulder. You tap the sole of the or your rug. Okay? Hey, are you okay? Right? Now, if the infant is unresponsive, okay, same thing. Call 911 and get an AED, same thing with the adult child. Now, when we assess, that's also the difference. Okay? When we assess the adult and child, okay, we check for the carotid pulse, right? Now, the difference for an infant, we don't check the carotid pulse. We check the radial pulse. Okay, this is where we check. Okay, now no pulse, no breathing, we start CPR. Okay, we're all clear with that? Okay, now the next thing, guys, is when doing compressions into an infant. Okay, the new update now is this. Okay. Last year, this is how we do compression if you're by yourself. Okay, this is how we do compressions. Okay, but now with the update, this is how we do compressions now. Okay, it's not like you are doing the compression like an adult or a child. It's like you're moving your hand like this. Okay, like that. For an infant. Okay, that's one technique. Another technique is 2 thumbs circling technique like this. 1, 2, 3. Okay? So again, if you are by yourself, it's 30 compressions, 2 breaths. Okay? But if you are with another rescuer, it becomes 15 compressions, 2 breaths. What we have to do was abdominal thrust only during the previous guideline. But with the update coming in the next few months, if it's an adult and child and the victim is still responsive, okay, we have to do now 5 back slumps. 5 back slumps. 1, 2, 3, 4, 5, and then 5 abdominal thrusts. Before it's just abdominal thrust, like the famous Hentic maneuver, right? But now with the new guidelines coming, okay, if an adult and child is choking, okay, they are responsive, we do 5 back slumps and then 5 chest thrusts. Okay? I'm sorry, 5 back slumps and then 5 abdominal thrusts. Okay? So you're going to do that repeatedly. Okay? 5 back slumps, 5 abdominal thrusts, 5 back slumps, 5 abdominal thrusts, until the object is out or until the victim becomes unresponsive. Okay, this one, take note. If the victim becomes unresponsive, okay, meaning the abdominal thrust and the 5 back slump was not effective, okay, and this one, all of a sudden, the victim collapsed. Now, the special consideration for choking victim when you do CPR is after you do 30 compressions, okay, before you give breaths, okay, you have to check for the object. If you see the object, you can try to remove it, okay, but if you don't see it, don't try to do a finger sweep, and then you give breath. 1, 2. But usually, based also on my experience, if someone is choking and you do the compression and they are unresponsive, usually the object comes out. Okay? Now, okay, last one regarding the infant. If an infant is become unresponsive, okay, I'm sorry, an infant who is responsive, okay, who's choking, okay, is very a sensitive topic, okay. So with the new guideline of AHA, okay, if this infant is still awake, okay, still responsive, but then showing the signs of choking, okay, we have to do 5 back steps, okay, 5 back steps, okay, 1, 2, 3, 4, 5, and then you switch the victim, okay, the baby. Last year, this is how we do the chest thrust, 2 fingers, right? But with the new guidelines now, we don't do the 2 fingers now, we do the chest thrust like this. Okay, 1, 2, 3, 4, 5, and then switch, 5 backs as 1, 2, 3, 4, 5. You see the difference? Okay, so no more 2 fingers, okay, even for the choking. If the baby becomes unresponsive, okay, we're gonna go back to our basics. We're gonna lay the baby on a flat surface, okay, and then compressions, okay, 30 compressions, okay, and then the special consideration for choking patient is you have to, before you give breath, you have to check for the object, okay. If you see it, you can try to remove it, but if you don't see it, don't try to do blind fingers.
I'm assuming all of you who are here are going to the math, right? Yes or no? Thinking about it. There is a cookie, so if you say loudly, you will get the cookies, okay? Yeah. So I just wanted to let you know about the program. I have the brochure and some study material for you all. Please come and grab from my table, and if you have anything, we are located in Woodbury. 1000 Woodbury, you can stop by to our office for more information, okay? Thank you once again, and thanks to you for letting us come. Thank you so much. And have a good day, and all the best for your exam, okay? Get 100.
We are like completely here to do something to the community. So I approached Ankit, and he helped me from the Xavier University Aruba school. It's a school of medicine. So they come forward to help the community, and they sponsored everything right from the beginning to TANA. And I appreciate Xavier University School of Medicine, and in the coming days, I hope that you will come forward to do more these kind of sessions to the community. Thank you so much for the community to participate here without missing.
Good afternoon, everyone. My name is Mamta. I'm from Xavier University School of Medicine, Aruba, and my colleague Manali, Dr. Manali, she's also from Xavier University School of Medicine. We are here with the association with the Telugu Association, and we are here to help the students who are prospective students who are interested in the medical program, and they are also part of the BSL program. So anyone who are interested in medicine, they can come forward and join the Xavier University. It's not only for the Telugu Association, American Association community, but they are also doing some great community work, which along with the Xavier University, we are together in helping this community and building the community.
So we are medical school based in the Caribbean, in Aruba. We offer medical science and as well as veterinary school. So we have many programs for many interested students of all ages. If you have any questions, our main office is in Woodbury, New York, Long Island. So we'd be happy to help you. Thank you.
My name is Mon Dimapelis from Dimapelis Life Care. So I'm the lead instructor for the CPR training, and it was a great experience here with the community. We taught people how to respond to emergency situations for an adult who is unresponsive, for a child, an infant as well, and also how to respond to choking victims. And everyone was they participated very well, and it was a great experience. So thank you so much.
నమస్తే అండి. TV5 ప్రేక్షకులందరికీ కూడా, వీక్షిస్తున్న వాళ్ళందరికీ కూడా తానా తరపున, న్యూయార్క్ తానా టీం తరపున మా అభినందనలు. అదేవిధంగా మేము ఈ రోజు అసమయ హిందూ టెంపుల్ ప్రెమిసిస్ లో CPR అండ్ AED ట్రైనింగ్ ప్రోగ్రామ్ విత్ సర్టిఫికేషన్ కండక్ట్ చేసామండి. దగ్గరగా 30 పార్టిసిపేట్ చేశారు. వాళ్ళు విత్ సర్టిఫికేషన్స్ దే ఆర్ వాళ్ళకి వస్తుందండి. అదేవిధంగా దగ్గరగా 100 పీపుల్ వచ్చి అన్ని రకాలుగా ఈ కార్యక్రమాన్ని జయప్రదం చేశారు. మేము ఎంత చేయటానికి ముఖ్యంగా మాకు జేవియర్ యూనివర్సిటీ స్కూల్ ఆఫ్ మెడిసిన్ వాళ్ళ సహాయంతో మేము ఇవన్నీ చేయగలిగాము. వాళ్ళు ఫుల్ స్పాన్సర్షిప్ చేయటం వలన వాళ్ళు ముందుకొచ్చి ఈ ప్రోగ్రామ్ అంతా కూడా ఎండ్ టు ఎండ్ వాళ్ళు మాకు హెల్ప్ చేశారు. అదేవిధంగా మా తానా న్యూయార్క్ టీం ప్రసాద్ కోయి గారు, సుచరిత అనంతనేన్ గారు, రజితా కల్లూరి గారు, అలాగే కలీం గారు, అదేవిధంగా జితేంద్ర యార్లగడ్డ గారు, ఇంకా అనివార్య కారణాలుగా రాలేకపోయిన దిలీప్ ముస్నూరి గారు, అలాగే శ్రీనివాస్ నాదెల్ల గారు, మేమందరం కూడా సమిష్టిగా కృషి చేస్తేనే ఈ ప్రోగ్రామ్ ఇంత సక్సెస్ అయింది. ఇలాంటి ప్రోగ్రామ్స్ ఎన్నో ముందు కూడా చేయాలని మేము సంకల్పించుకుంటున్నాము. ఇన్ ఫ్యూచర్లో కూడా ఈ కమ్యూనిటీ ప్రోగ్రాంతో పాటు ఒక గ్రాండ్ డివైన్ సెలబ్రేటివ్ ప్రోగ్రామ్ కూడా June 6th శ్రీనివాస్ కళ్యాణం అనే ప్రోగ్రాము మేము ప్లాన్ చేస్తున్నాము న్యూయార్క్ టీం తరపున. మాది యాక్చువల్గా 50th ఇయర్, నెక్స్ట్ ఇయర్ తానా 50th ఇయర్ సందర్భంగా టు స్టార్ట్ విత్ శ్రీనివాస్ కళ్యాణం ఫ్రమ్ తానా న్యూయార్క్ టీం. ఇది మేము ప్లాన్ చేసామండి. తప్పకుండా టీవీ చూస్తున్న అందరూ కూడా ఆ కార్యక్రమానికి విచ్చేసి దిగ్విజయం చేయాల్సిందిగా మా న్యూయార్క్ టీం తరపున అందరికీ మా శుభాకాంక్షలు అండ్ అదేవిధంగా మా విన్నపం కూడా. థ్యాంక్ యూ సో మచ్.
న్యూయార్క్ తానా టీం తరఫున అందరికీ అభినందనలు. ఈరోజు కమ్యూనిటీ సర్వీస్ అయిన CPR అండ్ AED ట్రైనింగ్ సర్టిఫికేట్ తోటి, ఈ సర్టిఫికేట్ 2 years వ్యాలిడ్ ఉంటుంది. దానివల్ల మంచి ఉపయోగము. అదేవిధంగా మాకు జేవియర్ యూనివర్సిటీ వాళ్ళ సహకారం అందించినందుకు వాళ్ళకి కృతజ్ఞతలు. TV5 ప్రేక్షకులందరికీ అభినందనలు. అలానే మా టీం మొత్తం చాలా కష్టపడి ఈ ప్రోగ్రామ్ని ఇంత వింటర్లో కూడా, ఇంత చలికి కూడా 30 మంది పార్టిసిపెంట్స్ని తీసుకురాగలిగినందుకు మా టీం అందరికీ కృతజ్ఞతలు. అలానే శ్రీనివాస్ గారు మెన్షన్ చేసినట్టు మేము తదుపరి కార్యక్రమము శ్రీనివాస్ కళ్యాణం అనుకుంటున్నాము. అదేవిధంగా కమ్యూనిటీ మొత్తం శ్రీనివాస్ కళ్యాణంలో కూడా ఇలానే దిగ్విజయంగా పాల్గొని మమ్మల్ని అందరినీ హ్యాపీగా ఉండాలని కోరుకుంటూ సెలవు తీసుకుంటున్నాను. థ్యాంక్ యూ.
అందరికీ నమస్కారం. తానా న్యూయార్క్ టీం తరపున మేము చాలా ప్రోగ్రామ్స్ చేస్తూ ఉన్నాము. అండ్ ఈ సంవత్సరము మేము ఈ CPR AED ప్రోగ్రామ్ తోటి ఇక్కడ స్టార్ట్ చేసాము. అది దిగ్విజయంగా జరిగింది అండ్ చాలా హ్యాపీగా అయింది. అందరూ ట్రైనింగ్కి వచ్చారు. 30 మంది పార్టిసిపెంట్స్ వచ్చారు. అందరూ వాళ్ళ సర్టిఫికేట్స్ తీసుకుంటున్నారు. చాలా సంతోషంగా ఉంది. అండ్ ముందు ఇంకా చాలా ఇలానే కార్యక్రమాలు చేద్దాము అని శ్రీనివాస్ భర్త గారి ఆధ్వర్యంలో మా టీం అందరము మేము సంకల్పించుకున్నాము.
My name is Aris Muhammad and I came from Plainridge Middle School. I'm 14 years old and in 9th grade. I joined this event because I thought it would be nice to get to know how to save lives, and I want to be a doctor when I grow up. So I thought this would be very useful to me in the future.
Hi, my name is Manasi Dandakuri. I'm a junior and I go to Jericho High School. And I want to do this event because I want to learn more about CPR, and I know that a lot of people talk about it in school and how to get certified, and I really want to try to help people as much as I can. And I thought this event was really helpful and inspiring to learn more about other certifications I need, beyond basic life support.
దొడ్డపనేనండి. ఇక్కడ హిక్స్విల్ న్యూయార్క్లో ఉంటాను. ఈ తానా వాళ్ళు కండక్ట్ చేసిన CPR ప్రోగ్రామ్ విచ్ ఇస్ లైఫ్ సేవింగ్ ప్రోగ్రామ్ అటెండ్ అయ్యాను. ఇది ఆల్మోస్ట్ 2.5-3 hours ప్రోగ్రాము. ఇది చాలా ఉపయోగకరంగా ఉంది. దీనివల్ల ఏంటంటే మనం ఏదైనా మనిషి చావు బతుకులో ఉన్నప్పుడు ఆర్ ఏదైనా డిఫరెంట్ కైండ్ ఆఫ్ సిచ్యువేషన్స్లో ఉన్నప్పుడు మనం సిపిఆర్ అంటే హార్ట్ని పంప్ చేసి బ్లడ్ని పంప్ చేయడానికి బ్రెయిన్కి ఉపయోగపడే ప్రోగ్రామ్ అండి ఇది. అండ్ ఇది ఎక్కడైనా చేయొచ్చు. మన ఫ్లైట్లో ఉన్నప్పుడు ఎవరైనా పడిపోవచ్చు, లేకపోతే ట్రైన్లో ఉన్నప్పుడు, లేకపోతే ఎనీవేర్ ఆఫీస్లో అవ్వచ్చు, ఎక్కడైనా జరగవచ్చు మనిషికి. సో మనిషిని బతికించడానికి ఉపయోగపడే ఇదండి సిపిఆర్ ప్రోగ్రామ్ ఇది. థ్యాంక్స్ ఫర్ తానా వాళ్ళందరికీ.